When a patient's heart stops, the earlier you give CPR, the better the chance of survival. But for some patients, CPR is not the only answer. Sometimes, an abnormal electrical rhythm causes the heart to suddenly stop. This abnormal rhythm is known as ventricular fibrillation, or VF. The only effective treatment for VF is defibrillation. This involves giving the heart an electric shock. The earlier defibrillation occurs, the higher the survival rate. An automated external defibrillator, or AED, is a device that can read or analyze the heart rhythm electronically and tell you if defibrillation is needed to stop the abnormal rhythm. There are many brands of AEDs, and the Pre-Hospital Emergency Care Council does not endorse any one brand. Although AEDs may differ slightly, the same steps are used to operate all AEDs. Each AED has a voice prompt which will guide you through the process. You should use an AED only if the patient does not respond and is not breathing. Perform CPR until an AED is available. When the AED is available, stop CPR, turn on the AED, and follow the voice prompts. The steps for using an AED are as follows. Turn on the AED. Place the pads on the patient's bare chest. It is really important that the pads are placed correctly to ensure that the defibrillation energy goes directly through the heart. Place one pad on the right, centrally, just under the collarbone. Place the second pad under the left nipple and in line with the armpit. Make sure no one touches the patient. AED will advise when to push the shock button if a shock is needed. One shock is given, followed by 2 minutes of CPR. Repeat this process until an appropriate practitioner arrives and takes over. A "No Shock Advised" prompt means that the AED was not able to detect a shockable rhythm. Commence CPR and continue for 2 minutes. Follow the voice prompts. AED Special Situations. Using an AED requires awareness of some special issues, so you can take appropriate action and precautions. There are special issues to be aware of when using AED. Whenever water is near a patient in cardiac arrest, quickly move the patient away from standing water, dry the chest, and apply the electrode pads. As long as the chest is dry and the pads are securely attached to the chest, risk of shock to the responder is very low. Cardiac arrest in children is rare and is usually caused by a breathing problem or an airway obstruction. Although you may not recognize the exact age of a child, AEDs may be used on anyone aged 8 and over by responders. Before attaching the AED electrode pads, remove any medication patches and wipe the skin clean. When exposing the chest, if you notice an implant like a pacemaker or defibrillator, apply the pads away from the implant whenever possible. Your instructor will now take you through the steps of AED use in your groups.